probiotics really play a role in, and our gut health actually plays a role in. So one of them is helping to clear up skin issues. So that could be eczema, psoriasis, acne, and dermatitis, just basic rashes. That can be stemmed basically out of your gut. That's telling me a lot about what's going on inside their body. And that is telling me that their gut is really out of balance. It's what you would call dysbiosis. And that dysbiosis is what means your bacteria is out of balance. So you have too many bad guys too many bad bacteria and not enough good bacteria. So that's where you have to shift that. So the first thing you can do, and the best defense, is to take a probiotic. So that is definitely what I would recommend if you are having those issues. Acne is a very common thing that I've seen. I don't want to say super common, but that is a complaint that I hear occasionally of, I've never had any acne problems, and now all of a sudden, since surgery, I started having all this acne. What's going on? So then that just leads me to, okay, let's start working on your gut, and let's try to correct that as quickly as we can. So that's something that most people don't even attribute a probiotic helping. So if you have had any of those issues, then jump in and throw that probiotic in, or some probiotic foods in. Definitely with dairy, wheat, gluten, those type of things. Those are your two most common triggers for the skin issues. But also took a probiotic, and they got consistent at taking a probiotic every day. Gone. The second secret or mystery thing is mental health conditions. So this I see a lot, actually. I see a lot of patients when they come into the center, they are struggling with anxiety and depression. Those are probably the two main things. And there was actually a study that I found on some patients that they did for 8 weeks, and they put them on probiotics, and it only took 2 months, and their depression went down. They actually tested their inflammatory markers in their body, pre and post probiotic, and the inflammatory markers also went down. And the common or the main inflammatory marker that we monitor is the CRP, which is a C-reactive protein. And that one, they found in the study that it actually decreased after just 8 weeks of probiotic use. They also found some side benefits of it lowered their insulin level and lowered their inflammatory markers in their body and decreased their depressive symptoms. You would start seeing some slight improvements. But it's not something that you do just short term. It's something that you should just continue to do, because that probiotic is helping support what your body is not able to do in the short term until, things get corrected. So why is it really bad? And that's what I start digging for. So probiotics can help with any of those mood issues that you may be struggling with. So I would consider that. And then losing weight. So probiotics, this is not an unknown thing or a secret or mysterious thing. This has been known for a long time, but you don't necessarily think of a probiotic being your support for helping improve weight loss. So if you are struggling with a stall, or if you're having weight regain, or you're having, issues with your weight, a probiotic to me is a no-brainer. Every study that they do on weight loss surgery patients, it's the same outcome. The people who take them lose more weight than the people who don't. And the last one is to prevent and treat diarrhea and constipation. So that's also a pretty common problem with our population. So right after surgery, you can have diarrhea for the first couple weeks. Just surgery in general can do that. After that, really, you shouldn't be having any diarrhea. And if you are, then something's going on in your gut. You can have just a gut infection, or it can, be other contributors. Constipation is probably the most common complaint, and that is something we work really hard on to try to get solutions to. Probiotics is going to be your best defense in treating both. But you would use it short term. It's not something that you would do forever. It would be to correct it. Then if I have somebody else that's, super bad, first you got to go do the due diligence. Make sure they're talking to their doctor and checking for any gut infections like C. diff or, any parasites. Make sure all that is checked. Because you got to treat those. If there is something going on, you've got to treat that. And just taking a probiotic isn't going to fix it. So make sure that you are going to your bariatric team and having this conversation, or your family doctor, and making sure that those things are getting checked, because you don't want to leave those unlooked at. The biggest game changer really is fermented foods. So adding in like the sauerkrauts, that's awesome. The kefir, which is kind of like a drinkable yogurt, and you can buy it at any grocery store. And that would give you some of that live bacteria and get your gut moving a little bit faster. Remember this, your body wants nothing but balance. So anytime that you can balance out your the bacteria so that it's all happy and you have more good bacteria than you do bad bacteria, guess what? You're going to feel fabulous, because that's when everything's working like it's supposed to.